Hi everyone, my name's Abby Dewhurst. I'm an analyst at NHS Dorset. I'm joined by Claire Davies, who's an analyst at Bournemouth Christchurch Council. We also had a project member, Christoph Sepper from NHS Dorset, and we had additional support from Andy Poole, who's a data modelling lead at NHS Dorset. Our project is a discrete event simulation model to reduce rheumatology waiting times in Dorset. So you may have seen in the news about the waiting list. They're the highest that the NHS has seen. Here in Dorset, and rheumatology is a specialty, it's no exception. We've also been impacted by this. One of the main priorities at my organisation is recovery, thus reducing the waiting list backlog and in turn improving waiting times for patients. The aim of the project was to look at what changes in capacity could be made to reduce the waiting list and waiting times in rheumatology. This was done using a discrete event simulation, which is a technique that models flows through a pathway and can show what happens if changes are made. We chose rheumatology because it has a well-established and collaborative network. The stakeholders were engaged and enthusiastic, which was useful for getting the data we needed for our model. When we first decided on this project, the waiting times were higher at Dorset County Hospital, however they had a shorter waiting list. And due to the disparity in waiting times, we thought about modelling the impact of moving patients from Dorset County to the other hospital we have here, University Hospitals Dorset, which is made up of Poole and Bournemouth Hospital. We did some patient mapping in QGIS, which showed that patients living in the west generally went to Dorset County Hospital, and patients living in the east usually went to University Hospitals Dorset. So through some stakeholder engagement, we learned that a patient is added to hospital's waiting list according to their postcode, which explains this east-west divide that we see. Patient engagement showed that patients would rather wait longer and be seen close to home than move to another hospital for a shorter waiting time. And after speaking with consultants, they wanted a model around increasing clinics and how this will impact the waiting list. So ultimately, that is the direction that we went in. Now I'm going to pass over to Claire to go through our process mapping.
So this was our original process map, which looked at everything from the initial GP visit, where the patient has presented with rheumatic symptoms and the GP has decided to make an urgent or routine referral to rheumatology, or whether indeed to send the patient to A&E. The routine referrals then go to the consultant triage, who again decide if it's urgent or to put the patient onto the waiting list or discharge them back to their GP. It then goes through to bookings, and the admin team make the first appointment with the rheumatology consultant. This first outpatient appointment may be followed up by diagnostic tests, and then it feeds into the decision to either discharge, offer a follow-up appointment to the patient, or give them PIFU, which is where the patient books the appointment themselves. The HSMA programme taught us to ignore all of the noise in the process and just focus on the bit that we needed in the model. So with this in mind, we came up with a much more simplified process map, which started from the point the consultant had accepted the referral and went through to discharge follow-up, which was our exit or our sync in DES terminology. So from what initially looked quite complicated, it was actually a really straightforward process to model. So you can see we've got the patient coming in, the patient referral is accepted, they're added to the waiting list queue, they're allocated an appointment slot at either of the hospitals, and then they're either discharged or given a follow-up, and then it goes to our exit. I'm just going to hand over back to Abby to show you the model that we built in Streamlit using Python.
So we wanted to keep it simple and easy to use for stakeholders. Our parameters are on the left, and these are the model inputs, which you can adjust with the sliders. You're able to change the capacity at each hospital, which are the appointment slots per week, the demand at each hospital, so that's the average referrals, the waiting list backlog, so how many patients are waiting on your waiting list, and how long you want the simulation to run for, which is defaulted to a year. Our outputs are a mix of metrics and visuals. So we have the capacity and the waiting list here, which are determined by the parameters. We have the waiting list at the end of the simulation, the waiting time for both hospitals at the end of the simulation, and we do have some trends. So the waiting list trend over the course of the simulation for both hospitals, and the trend as well for Dorset as a system. We also looked at the average waiting time by the hospitals across the simulation, and you're able to download the data as a CSV file as well. Our next steps in this would be to get these trend charts for the waiting times as well. So when you adjust your model inputs, the visuals will update to reflect your changes. So for example, when increasing Dorset County's capacity from 22 appointment slots to 27, you're able to see that the changes are reflected here. There's been a reduction in the waiting list at the end of the simulation. The waiting time has gone down, and the trend, which was before an increasing trend over the simulation, is now sort of stabilizing and then decreasing, and that's just by changing that capacity a few appointment slots. So back to the presentation. In terms of project impact, this model enables rheumatology staff to look at how changing the number of clinics and demand influences the waiting list as a hospital and a system. The model will be able to support consultants in their business cases for increased capacity by showing how it impacts waiting times and the waiting list. And this will in turn be beneficial for patients in hopefully reducing their waiting times. I'm now going to hand over to Claire for our course reflections.
So we found the programme covered a lot of interesting content. You learn about many different analytical methods. Sometimes it felt a bit overwhelming because there was so much advanced content, but it was a really good overview of lots of methods that we may revisit in the future. With our project, we realised the importance of stakeholders in defining and understanding the problem and how the project can support them. Dorset Rheumatology were involved from the very beginning. It was very much not just an academic project. We felt a great responsibility to deliver something of benefit to the service. We did have a few project struggles. Our project team had never coded in Python before the programme, and we did struggle to make some of the desk coding examples that we were showing fit our particular business problem. So with this in mind, we did need additional programming support from a colleague who has strong Python skills, and we probably wouldn't be able to finish our project without him. There were different levels of experience in the programme participants, which was good, but sometimes it felt a little bit hard for us to keep up. Our colleague Chris actually left the project due to difficulties with the coding, and he also found the time constraints of juggling his day-to-day work with the project quite tough. However, we're really proud that we've produced a model that can hopefully help our stakeholders in the future. I personally feel I've learned a lot. I'm the only person in my organisation, BCP Council, who's done this programme, and I worked on an NHS project with Abby. There's now an expectation for me to embed Python and some of these methods within social care at the council. However, I feel I can reach out to the HSMA network to ask questions going forward, and also the NHS Python community. Finally, we just want to say thank you to everyone who supported us in this project and the HSMA programme, and thank you to you for listening.